Welcome. This is the Health and Wellness Coach Journal podcast. I'm your host, Dr. Jessica Singh, the founder and CEO of the Center for Health and Wellness Coaches. This is a podcast for coaches to explore topics related to health, wellness, and coaching, sharing knowledge and sharing light. Welcome. In this episode, I have the privilege of interviewing Dr. Sharma. Dr. Sharma is a double board-certified physician, Harvard-trained acupuncturist, and medical director of the Orthopaedic Integrative Health Center at Rothman Orthopaedics. She's a popular speaker at Google and an award-winning clinical assistant professor at Thomas Jefferson University Hospital. She specializes in non-surgical pain care and building customized healthy aging programs for patients. Dr. Sharma has studied lifestyle medicine, functional medicine, and integrative medicine. She has studied yoga and meditation at the Paramath Niketan in Rishikesh, India, and mindfulness at Thomas Jefferson University. She has completed Stanford's Physician Wellbeing Director course. At a national level, Dr. Sharma serves as chair for spine and pain rehabilitation for the American Academy of Physical Medicine and Rehabilitation, on the Diversity and Inclusion Committee, and on a national opioid task force. Furthermore, she continues to support alternatives to opioids and has directed a national physician course on navigating the opioid crisis. Dr. Sharma, it's such a pleasure to have you here today.
Thank you, Dr. Singh. I really appreciate being here with you.
I'd love to know what inspired your journey into holistic pain management.
So my background is actually physical medicine rehabilitation, which is especially not a lot of people are familiar with, but our goal is to help people function better. We help people with different levels function better. And so whether people are dealing with stroke, spinal cord injury, traumatic brain injury, or pain, it's things that affect their daily life. And when you look at people's daily life, you sort of see there's a lack of tools to help people, especially in sort of traditional medicine. And so maybe really want to open up the window and enlarge my toolbox and see what are things I could offer my patients to help them feel and live better on a daily basis.
How did you feel that alternative treatments or learning about alternative modalities has helped you bridge the gaps in Western medicine?
I think it's really helped bridge the gap of seeing the whole person. You know, Western medicine is, as you know, is very physical focused. And the physical piece is one part of our health. There's mental, there's emotional, even the biopsychosocial approach, which is like looking at how the brain and the mind and affects the body. It's still breaking it up, and it's really one thing. And I think that's where combining Eastern and Western medicine comes into play. It's looking at the whole person.
It's so wonderful that you took that initiative and pursued that opportunity to get all of the wisdom and education that you have on top of medical education. I think that was one of the most humbling things to me, is like you dedicate all your years to physician education and training. I remember thinking like, okay, I'm going to learn everything I need to know about health and healing. And then, well, maybe health and healing isn't so emphasized in emergency medicine, right? It's the acute side, but you finish it and you're like, wait a second, I don't see the whole person, and I know how to give pain medicine, but what about actually things that can get at the root? So it's wonderful that there are physicians such as yourself. We're bridging the gaps, and hopefully one day it will be more and more integrated into standard medical education.
Yeah, I really hope so. And I think, you know, the work you're doing in the organization is really that we do need a team approach. We need physicians, but we also need coaches, because we need physicians in some ways to sort of give the big picture part, but then coaches to do the daily work with people who are trying to live better.
One of the reasons why I was also so excited to speak to you is, especially after reading your book, The Pain Solution. It's amazing. I have like so many sticky tabs, even as a healthcare provider, you know, like despite the physician background, it's still all sticky stuff because you do such a good job of breaking it down into simple, educated, and sophisticated ways that are so practical for everyday living. And like a lot of this nuanced knowledge we don't really get in one place. And so one of the reasons I'm so excited to have this opportunity to speak to you is because, like you said, it's a team, right? The more and more people we can get involved to help people promote health and well-being, we need it, with given the shortage of supply of healthcare providers, but there also has to be quality. So, with health and wellness coaching, especially, there's certification and standards, but even with that, it's very new. And there's so much variation in the backgrounds of people who are becoming coaches. And so, your book does such a fantastic job in an evidence based manner of going through really pain as an overview, right? And then what the problems are and how to holistically approach it. What inspired you to write this?
It's sort of what we touched on is that in Western medicine, it's so divided about just looking at the physical health and not the other factors that impact it. And we're also so constrained, especially for physicians or anyone really, honestly, any healthcare person working in the insurance sector. There's so much time constraint that we can't talk about these things with our patients. So I would love to sit with a patient for an hour and talk about fuel, how their food, their sleep, their mindset, how that all affects their pain. But I don't have the gift of that time. And so this was sort of like a workaround. This was, and sometimes I say that to people, this is everything I want to tell you, but I don't have time to tell you. It's all right here, and so I'll do the normal shtick here and we'll talk about the therapy and the medications and injections and sort of the traditional treatments. And I'm not trying to poo-poo those. I think they have a role, but I think they are helpers. And I think the mainstay of care should really be these lifestyle treatments. And then those other things are helpers to get people over a hump or people who are in a difficult situation.
What are some of the outcomes or you've seen from people who have read your book?
I've seen some great outcomes. Some of my patients have read my book. They've seen it online or wherever else, and they have come off of their pain medications. I have a 50-year-old female who has severe stenosis, which means severe narrowing of the spinal canal in her low back. So the nerves to her legs are being pinched off. And she was able to get off every medicine, including Advil. It's made a big impact. And just like anything else, it doesn't work for everyone, but it seems to help everyone just to different degrees. And so I think that's been really a blessing to see.
That's really incredible and life changing for that person that you spoke about. And I'm sure for all the people who are benefiting, it just having that pain or acute flare is so debilitating.
Yeah, and unfortunately, like more than 80% of people suffer from just low back pain alone, just talking about one area at some point in their life. So it's almost a universal experience. And so that's sort of what the concept is in the book is about is thinking about prevention, how to reduce overall inflammation, but also how to cope with pain when you have it and how to build resilience because we know we're going to face these painful challenges.
Hmm. And in your book, I know you describe in detail the 5R relief method. And would you like to share a little bit about that for listeners?
Sure. Yeah. So it's sort of a term I coined, relief 5R. Try to do 5Rs to make it sort of memorable and catchy because it helps people. So it's refuel, which refers to food, revitalize, which means movement, recharge, which is about sleep, refresh, which is about resilience and mindset, and then relate, which is about relationships. And the whole plan is based on something I call microboosts. And those are little steps that add up to big relief. And sort of like you mentioned, I think this is really about any painful stressor that could be mental, emotional, or physical. This concept of impacting and reducing stress and inflammation at sort of a ground level can really affect all of health conditions that we deal with. And so it sort of circles around pain, but this is really like a healthy living approach.
Yeah, I was a little humbled, when I read your section about fuel and the sugar part, especially. I was like looking at all this stuff and where sugar comes in during the day and how that relates to pain. And it was very humbling and eye opening. So thank you.
Oh, yeah, you're welcome. And that's just the kind of thing that, like, as physicians, I mentioned this in the book too. Like, I didn't know how to read a nutrition label. I didn't know some very, basic health things that are empowering and that everyone should know. And if I don't know them, how can I, help my patients or people I work with? So I think it's more about the knowledge is power and talking about how fuel impacts pain, how your stress, your sleep, all these little things, watching stressful news, politics, all that things. If you picture someone that you think of as sort of antagonistic person or on the opposite political side as you, a lot of us will sort of feel that tension in our shoulders, that tightness. We'll sort of hunch in, get small, and so there's a real impact there. And it's really thinking about what am I exposing myself to, what am I feeling myself with, and is that going to give me the outcome I want and improve my well-being the way I want.
The information that you share is universal. Like anyone at any stage, any ethnicity, any culture can use it. And so it's such a tool for any health and wellness professionals, especially coaches, to use to be able to help support their their clients, anyone wanting to help themselves heal.
Thank you. I really appreciate that. Yeah, it that was the idea, to sort of make it something that is accessible to, and not too sciency, and sort of bogged down in studies. At the back of the book, I have a list of all the studies. Like you said, it's evidence based, but it was sort of breaking down the information so it's practical. Because it's really easy to say to someone, "Oh, eat healthy, go lose weight, sleep better. You should sleep better. You should sleep more." But if you don't give people practical tools, it really isn't going to happen.
And the other part, like you had mentioned too, that whole person approach, because there's so much psychologically too, just with chronic pain and the role that it plays in how we identify with ourselves and how we relate to the people around us and how we function in this world. And so, one of the things that I love too, I know you had mentioned not having too much time with your patients. So, it's like, here's my book, please let me help you this way. At least in a coaching conversation, you have like at least 30 minutes with someone instead of the 7 we would get in the hospital. And so it's really nice to be able to zoom out and realize all the different components of someone's life that go into how they feel about a certain disease entity. Because I know, especially coming from the background from a healthcare provider than being a coach, one of the things that was a hard shift was someone had a lot of chronic disease and a lot of pain management. The first thought is refer to pain specialist. That's like out of my box.
Right, and I think it can be daunting. Yeah, and I think, there's stigma with it, and then there's also sort of a feeling of hopelessness kind of across the board sometimes for patients and physicians and maybe coaches too, that, this person's already sort of in a tough spot and it's sort of above my level to figure it out. And I think that's sort of like anything in life. We try to make it really black and white, and it's not. There's a spectrum. There's always little things that you can do as a coach or a healthcare provider to help chip away at someone's pain, to help with their inflammation, to help with their mindset, without always putting the onus of cure on yourself or that person. And again, coming back to sort of my roots in function, is having these functional goals. I want to be able to walk to the mailbox. I want to be able to go to my kid's soccer game. What can we do to make that happen for you, even if your pain's not zero?
That's such a nice perspective on it, because then it brings hope and it brings, like, okay, maybe it won't go away forever, but at least it can come to a place where I can live.
Right, where you can still have joyful moments. It's not that it gets to rob your life of joy, of happiness, of everything good. It's that, okay, this is something I'm dealing with, and how can I make this be a backseat in my life and not the front seat?
And for health and wellness coaches, especially, as a lot of them work side by side with physicians, one of the biggest things is knowing scope of practice and when to refer to a physician. And so, how might someone who's a health and wellness coach, I feel like there's so many ways that someone could really use the information in this book to help their clients work with their doctors.
I think having the team approach, and really in the book using those microboosts, and I have level one, level two. Level one are a little more simpler, level two are a little more advanced. So depending where your client or patient is in their journey, and they might be a level one in nutrition, but a level two in mindset. Because people are at different places with different areas of their life, but using those as a concrete. So the physicians again then just manages the big picture, but then the coach would come in and say, okay, this is your goal, is to eat healthier. Which of these microboosts work in your life? And how can we adapt them and sort of customize them to your lifestyle? Like you said, whether it's the cultural foods you eat, or whether it's timings of food you eat, or it's shift work, or whatever your situation is, how can we make these work so we can reach your doctor's bigger goal that they have with you?
Right. Thank you. That's great information for coaches. And also, as coaching is still growing and slowly making its way more and more into mainstream medicine, it's also important for physicians to know how coaches can help support their practice too. Because, like you mentioned, the time constraint, there's so much administrative burden and other things to do, that it's really nice having that team approach, but having someone with the right education and qualifications to be able to help support the big picture.
Yeah, and I think that's where the training really comes in, like you said, to know when to sort of refer out to someone else or to work with your collaborator, and also when to say, stop the phone. We need to like rethink this whole plan. And I think that's where the training really comes in.
What are some, I know you had mentioned that person that who was able to heal from, when you think of, when anyone conventionally thinks of spinal stenosis, it's like surgery, this never ending journey of like in and out of doctor's offices and whatnot. And so be able to have recovery from that is quite inspirational and hopeful.
Yeah, and I think it's sort of a process, right? It's an ongoing process. So in this patient, I've been seeing her for years. She sort of started this program a year ago. She had some periods where she sort of let it go and she saw that the pain came back. So, it is something like stenosis isn't something that you necessarily cure per se. I mean, sometimes you can think of surgery that way. It depends on how people look at it, but it's something that you manage. And this is a like our management tool, and whatever you put in is what you get out. And so if you put in dedication and, you're making the nutrition changes, you're focusing on the sleep and you're focusing on the stress, those things can really help. Nothing's going to take everything away totally. But again, if you can make you do the things that bring you joy and bring that back to your life, that's really our goal.
I love the mindset emphasis that you have because also in your book, I know you had talked about there's so much in the media, obviously with food and food advertising, but also with pain management. It's like, Tylenol and Advil, aspirin all over the counter, and all of them can be fatal, right? If taken too much of. And even I loved in your book because even if you take them at the regular doses that you can, there's still so many side effects that people just don't talk about or think about or know about even. So it was very nice of how you laid everything out in your book.
Oh, I appreciate that. And that's sort of a message I give in some of the talks I give is I think our role is healthcare providers, coaches, and across the spectrum is to sort of be the billboard because there are no billboards that say, oh, eating right helps with pain. There are no billboards that say mindfulness can reduce your stress level. There's no billboards for, circadian sleep and sleeping at the right hours. There's no billboards for working on resilience to deal with your health condition. And so that's sort of our role as physicians and health coaches and other healthcare providers is to be the billboard and say, hey, this matters. And it's sort of being like bright and big and loud, just like those billboards are, because people are inundated with that constantly. And so we need to sort of be just as shiny and appealing and say, look, you can do this. And it's really not buying more products or tools. It's not more invasive stuff. It's things you have or we're going to consume anyhow. And it's just tweaking them.
I love that. The next time I drive on a highway and see a billboard, I might visualize what one might look like for this.
Yeah, just imagine your face being like jazz hands and yeah, eat less sugar and do this mindfulness activity. I like that even before we started this podcast, you had us do a grounding mindfulness exercise because I don't know, that was just beautiful. It really showed me that, you embody your words and, are true to them with your actions. And it's something I tell patients, and I mentioned in my book too. It's really important to have that transition time. And so going from sort of work self to home self, even if people work from home, and doing like a 5-minute mindfulness to sort of let go of the work stuff and become home you is really important. And if you do go to work physically outside of the home, then doing it in the garage. I'll tell people doing their parking lot garage or their driveway at home if they just want to get home first, and then just sit in the car for 5 minutes and use whatever free app you want, or if you have something internally that you'd use, and just sort of decompress and let it go. Because otherwise, you're walking in burnt out already. You're walking into your home life burnt out from work. And without those transition times, it can really just sort of pile up. And then suddenly you're just going to kind of spiral.
Yes, important of taking even just a few moments to just be like, let it go wherever we are in the day.
Yeah, exactly.
So in the book, I love also because you give different case examples in each chapter, which is so nice with the 5-hour relief method. And one of the things is, as a doctor, as a healthcare provider, you get to see patients and you get to see obviously when things aren't ideal, but then you get to see these beautiful cases of people who get to heal themselves. We get to witness that more than most people get to witness that in their lifetime. And so I think what can be challenging for someone if they are suffering from whatever condition they are is not knowing where to find the good stories. Where do you find the happy endings when you like are in your normal social circle where everyone's trying to just survive?
You're right. That's so hard. And, like we said, news and things like that are obviously sort of a negative slant and sort of fear based. And it is having these stories that sometimes we do get to witness in healthcare about people getting better. And I share some of those stories in the book. I think people experience it themselves if they do some of the suggestions in the book too. Is they sort of start to feel a little better. And again, we're not talking about instantaneous cures or anything, but it's like these little glimmers where you're like, oh, this is a little better. I feel a little better here and a little better there. And I think that sort of motivates people to keep going.
Right. One of the places where I personally like to go to find the good stuff or the happy stuff is in books. And so your book is definitely one of those places I go. So thank you again for your gift because it's so well written and so well done.
Oh, that's so kind. Thank you.
For anyone who is looking to heal themselves from one of those chronic conditions, whether it's spinal stenosis or another like interminable chronic disease or another terminal chronic disease, is there anything you would say to them about their pain? Any message of hope you would give?
I think the message is that you do have power over, even though if you don't feel powerless, even though, excuse me, the message is that you have power even if you feel powerless. You know, it's just that you may not have been introduced to the tools that can help you, but they're out there. And like you're mentioning, there are good stories and there are people who heal. Those stories are out there too. There are things you can find in the book. There are things you can find on your website, on my website. There are stories of inspiration, and there's information that's evidence based. It's not just sort of all anecdotal too. There's rigorous studies that show that these changes help. And so you really have the power. It's just being given the right tools. And sometimes, unfortunately, it requires a little digging in today's system and it's not so obvious. But once you find them, there definitely is hope.
And the system is obviously it's evolved so much. Like obviously the Andrew Weil Integrative Medicine Center, like you can, and there are physicians such as you with integrative, few and far between. But I'm so grateful that there are people and there's opportunities for people to get trained because even just the way it's like completing interests, almost the way our healthcare system is designed for providers. It's like patients per hour and the amount of procedures and medications given. But in reality, like there's growing value based care models now, which is wonderful. So it's actually emphasis on value and like, who celebrates? You celebrate when your patient heals. They are celebrating when they heal. And it should be further acknowledged in our healthcare system itself. So these are very small steps taken by wonderful people such as yourself and to change the healthcare system. That's how I view it with the work that you're doing.
Oh, thank you. And I think most people in healthcare are good intentioned and just sort of get caught up in the system. I think everyone who goes into healthcare really wants to help in some way. And sometimes we get bogged down in the work, sort of the paperwork and all the administrative tasks that you were mentioning. So I think doing things like this helps you see that you can make a difference, even if it's not in the way you envisioned, maybe.
Right. And sometimes the difference, like you said, whether it's like throughout your day, just remembering to take a moment for yourself or tell somebody to take a moment, or if it's giving someone a book that you adore as a gift if they need something. So these small steps really go a long way, like you said.
Yeah, and that sort of piggybacks on something, that's really important too, which is pro-social acts. So helping someone else, whether it's giving them advice, whether it's giving them a book, whether it's holding the door open for them, whether it's saying thank you in a world where people don't say thank you as much as they should, that can make a difference. And the science behind pro-social acts shows that when you do something kind for someone else, you actually receive more of the benefit than they do. And there's a lot of data on that too in the positive psychology field, and it's really neat. It's really neat to see the science behind something that maybe our grandparents taught us, but to actually see the science there, and so to be able to discuss it with patients and clients and say, look, this is a real thing, not just an anecdotal thing. It's not just a nice thing. This is going to improve your health. You being nice to other people is going to help your health too.
I wish that was a medical school. That's amazing. That's so beautifully said. Thank you. Just or just in regular school, like positive psychology. Yeah.
Yeah, and it's such a, newer field relatively speaking, in the world of medicine, and I think it's still siloed like a lot of medicine, and so it's something that perhaps people in psychiatry and psychology learn, hopefully in coaching as well. But, in mainstream medical school, I don't know that it's a common thing that's sort of explained or taught. Some people have heard of the placebo effect, right? Which is if you believe something is going to work, it has a higher chance of working for you. There's also a nocebo effect, and that is if you believe that something's not going to work, it has a higher chance of not working for you. The nocebo effect is stronger than the placebo effect. So that's where that mindset piece really comes in, and the psychology of it and your thought process. Because if you decide something's not going to work for you, for example, if you sign up to do acupuncture with me, I'm an acupuncturist, and you decide that acupuncture is kind of kooky, it's not really, doesn't really make any sense, then it's less likely to work for you. And the flip side is if you decide that this is the greatest thing in the world, it's more likely to work for you. And is that right or wrong? I don't know, but you've got to spin the cards the way you want. And I know it makes sense to spin them in your favor. So if you're going to dedicate yourself to something, to a treatment, to a lifestyle intervention, sort of do it wholeheartedly. to hopefully reap more of the benefits.
Right. I know you had mentioned also, well, at least in your background, you have experience with yoga and meditation, and then as an acupuncturist as well. For someone looking to figure out how to become more healthy or manage their pain with acupuncture, how might acupuncture help them?
There's several ways. I mean, acupuncture is, based on Chinese or Japanese medicine, depending on what schools of study you look into. And it's based on meridians, which are connecting points throughout the body. They're organ based. And it's the whole Chinese medicine organ based health system. But the Western medicine shows that it controls the pain pathways in our brain. So when they do functional MRIs that light up the pain control pathways, it lights it up. When you take a medicine called naloxone that blocks the opioid receptors, acupuncture doesn't work. So they know it helps with pain control. Western medicine isn't sure how. And then on the other side of it, acupuncture has been around for thousands of years as part of Eastern medicine. So we know it helps. Like with anything, you have to find a qualified practitioner who's licensed in their state or by the board. That's really the best way to go about it. The beauty of acupuncture is that there's really minimal risk to it.
It's beautiful and so in line with yoga too, because I know you'd mentioned meridians, and then in yoga, the energy centers are nadis, right?
Yeah.
And so it, and then the different bodies. So what you're talking about, the mind shift with the physical body, the mind body, the breath, the prana body, and then the mental sheath, and then the other sheaths. And it's amazing because disease starts in more subtle levels before it manifests physically, as is in most Eastern traditions, and I'm sure in other global healing traditions. And so it's amazing how, whether it's through cultural, traditional, different medicines and different holistic health systems that have been in place for thousands of years, all over the world, or slowly our medical, our evidence-based RCT studies, they're all different ways of getting to the same home.
Right. And it's all, and there are ways that are often, again, less invasive, less aggressive, less potential side effects, less potential downside than some of the traditional conventional medicine treatments.
Right. Well, thank you so much for sharing this glimpse and this overview. And I just wanted to ask you a takeaway for listeners reading to this. What is one message you'd give them to drive this conversation home?
I think that it's something we touched on lightly, which is with the right microboosts, the right tools, a proven plan, that you really have the power for your own life, your patient's life, your client's life to start living better starting today. It doesn't have to be a 180 turn. It can just be slowly chipping away and making little tweaks to your day that can add up to a lot more health and improved well-being. So I guess the summary is with the right microboost, you have the power to feel and live better.
Hmm. That's so well stated. Thank you. The one thing that comes for me too, after all the wonderful things we've discussed, is the power and the need to just listen to your own voice and your own intuition. Because just because something isn't mainstream doesn't mean that it doesn't exist or that it doesn't work. So everything you were saying about mindset and how all these things impact our system is just to have faith in our own ability for healing and that little voice inside.
I agree. And just to add one last thing with that, I think also if something doesn't feel right to you, to speak up. And I think that's something that sometimes is very paternalistic in healthcare, and people don't feel empowered to do that. If something doesn't feel right or set right in your gut, then just sort of speak up and say, look, I don't understand that. Or could you explain this? Or why are we doing this? Why am I taking this medicine? Why are we doing this procedure? I think that's really important because, again, you do have the power even if you don't recognize it yet.
Thank you so much. Well, I hope listeners feel empowered after listening to this. I know I do.
Thank you so much for having me. This is wonderful. And again, I appreciate all the work you're doing.
Thank you so much for everything. Thank you for listening. I appreciate you and value your feedback. So please subscribe and write a constructive review. If you'd like to be informed of new episodes and offerings and resources for coaches, sign up for our email list at www.centerforhealthandwellnesscoaches.com. Sending you warmth and light.